My name is Oluwayemisi Rose Oso Newton. I will be analyzing the strengths and limitations of passive communication in health and social care. If passive communicator turns out to their way, not to disagree, even if there is tendency to win over others, according to Johnson and Clay 2007. In health and social care environments, passive communications will be where individuals engage in the care responsibility or ignores the need to show concerns when they see something amiss without raising concerns with their colleagues, team leader, or managers. According to Moss 2017, the following are verbal indicators of passive communication: apology, indirective, voice of uncertainty, and failure to make eye contact, using a low voice and having a little body language. This may seem suitable and collaborative, but also an hindrance in sharing patient information. Characteristics of passive communications. They communicate passively and they are non-aggressive and lacking in disagreement or do what others advise them to do. According to Johnson 2007, they lack confidence when they are communicating with others and usually shows in their body movements and always avoid eye contact and speaks in a very quiet, low voice. And this may have impact on service users and staff in health and social care and providers who tends to have low assertiveness may not be able to assert and resisting unsafe practice. Not not capable of talking to patients in an effective manner, according to Batch and Grant 2015. And this attribute helps practitioners to in to helps early on how to support person ability on how to talk the talk in effective environment in health and social care, according to Staines and Fabry in 2013. A strength of a passive communication. It is not always ideal, but it has its own pros and cons in a certain way. It lets of conflict between people, between workers. Those with passive communication gives more value to structures in relationship by being calm and positivity, according to Agi 2021. And this can have a very positive impact in dealing with distressed patients and family members needing reassurance and emotional support. By Silverman, Curtis, and Drapers 2016. Patient empathy, awareness, and willingness are also conveyed in passive communication. Staines Fabry 2013. Passive communicators are very approachable because others don't think of them as over talking or imposing. And this work best in an effective ways in health and social care, in a degree of professionalism and confidence. Bramall, 2014. Limitations of passive communications. This can be very crucial over patient safety and quality of care, and poor decision making as well, and negatively affect patient safety when critical information is not communicated clearly. O'Daniel and Gosetin, 2008. One of the primary concerns is not giving accurate information when needed. This may lead to errors, failures, or unable to voice concerns on behalf of patients. And this can also be a problematic because the message may be generalized and unclear. In person-centered of care, passive communications requires understanding individual needs, preference, and values. This involves recognizing individual and including and caring for them in informed manner. Situation where passive communication is effective or challenging. Passive communication may be effective when calming tense situations and supporting emotional conversations. A non-confrontational, calm approach may be useful to diffuse conflict and help facilitate a therapeutic relationship. In passive communication in team collaboration, effective collaboration relies on clear communications, shared understanding, and timely information exchange by O'Daniel and Rosettin, 2008. Passive communication can also hinder teamwork when individuals hesitate to share ideas, raise concerns, and contribute to decision making. In conclusion, passive of communications offer strength such as empathy, patience, and conflict avoidance, but it also presents significant limitations in health and social care by Staines Pabry, 2013. Effective practice requires adapting communication styles to support person-centered care, teamwork, and patient safety. Batch and Grant, 2015. Passive communication is also styles that reflect lack of conflict and concerns for where there is needs. This approach can be a positive element in relationship building, empathy, and emotional support within health and social care. Thank you.